When I first came to the dentist here, I was a bit anxious and I didn't know what to expect.
I get nervous, Heidi doesn't. She doesn't particularly like it. She doesn't mind when she first of all thinks it's going to be a toothbrush, you know, and she's actually just going to have a toothbrush. But otherwise, she's a bit like, oh, what's happening? You know, she's got her fingers in my mouth.
I wouldn't say I'm particularly anxious when I have a checkup, but when I have teeth taken out or a filling, I am anxious.
As part of a community dental service, our patients are referred to us, generally from general dental practitioners who haven't been able to provide the treatment for one reason or another. My patients that I see have generalised anxieties or more specific anxieties and phobias, and some will have mental health diagnoses, learning disabilities or autism, and anxiety plays a part within that as well sometimes.
I've been experiencing a bit of pain in the lower jaw on both sides when I'm chewing.
Upper left, one. It's important to listen to the patient, make sure that our patient care is patient-centred and focused, and give them the support that they need to get through the treatment.
That's great, and you can help yourself to that tissue there, Stephen, if you want to just wipe your mouth. How did you feel that went for you today? Was that all right?
Good, thank you.
Yeah, not as bad as you thought it would be.
No.
Excellent.
Okay, so I'm just going to lie you back, okay? Here we go.
Yeah. The things that help me when I'm anxious at the dentist is when the dental nurse, when I had my teeth taken out, held my hand. That made me feel better. She was just smiling lots and talking to me.
They talk to me and everything, and I have to wear a pair of dark sunglasses and I just look up at the stars. And that's what I enjoy before they do things to me.
It's really important to have somebody like Charlotte who actually understands Heidi's needs and how difficult it can be for both of us, especially if she needs to have an operation as requiring just a fill-in. She just puts us as teams.
Got a 6.
There are some specific phobias that patients will present with. It's important to try and work out exactly which part of the procedure they're nervous about, and then we can go some way to treating that. There are a number of different techniques we can use to support the patient with this. For example, a procedure called Tell, Show, Do works very well for patients with specific phobias.
Okay, so this is my special electric toothbrush. Okay, and let's have a look on your thumb just to see how it feels. Good girl.
She was explaining what she was going to do.
Is that okay?
Yeah.
Well done.
And she showed me, like on my hand, how it was going to feel on my tooth.
Well done. Good girl.
One behavioural management technique that I use, which I think is quite important, is giving the patient a feeling of control. And before we start treatment, we will plan start and stop signs so that the patient knows at any point if they want to stop the procedure, they can do that.
If you just raise your hands up, I know you want me to stop, so can you practice that for me, please? Good girl.
By practicing that and making sure that the patient trusts and believes that you will stop if they raise the hand, that goes a long way to settling their anxieties and gives them back a feeling of control.
Well done. Okay.
Yeah.
Very good.
I find it very satisfying to feel that we've managed to help someone successfully achieve their dental care.
The things I like about going to the dentist are that it makes my teeth feel better.
Brilliant. That's fantastic. Well done.
Heidi likes getting a sticker afterwards, so especially if she's been good.
You should come to the dentist and don't be frightened, so that you don't get rotten teeth.
We know that if we can give patients positive experiences, if they feel empowered and have coping strategies, then hopefully they may go on for the rest of their life being able to accept dental treatment successfully.